There has been a drug recently FDA approved for treatment of symptomatic plexiform neurofibromas. This is a drug called selumetinib, goes by the brand name Koselugo, and this was FDA approved last month in April, and this was published by Gross et al. In New England Journal in April of 2020, and based on this publication, this drug is now available. And let me go through the SPRINT trial for you. This is a phase 2 open label, single arm, multi-center study coordinated by the National Cancer Institute as well as 3 other sites to evaluate the efficacy of selumetinib in pediatric NF1 patients with symptomatic inoperable plexiform neurofibromas. There were 50 patients in the study. Mean age was 10.2 years and 60% of them were male. The selumetinib was dosed at 25 milligrams per meter squared orally twice daily. And the target tumor evaluation was measured using volumetric MRI at baseline, every 4 cycles on drug for 2 years, and then every 6 cycles. The target plexiform tumor locations included the neck and trunk in 24%, the trunk and extremity in 24%, along with the head, neck, trunk, and extremities. Plexiform tumor status was progressive in 42% and non-progressive in 30%. In terms of the target plexiform tumor-related morbidities, the most common thing seen was disfigurement in 88% of the patients. Motor dysfunction was noted in 66% and pain in 52%, along with airway dysfunction, visual impairment, as well as bowel and bladder dysfunction. The number of plexiform tumor-related morbidities was a median of 3. So again, these were very symptomatic patients from their target tumors. And 48% of them had had previous surgeries for their plexiform tumors in the past. Now, selumetinib is a MEK inhibitor, and this is a class of drugs that inhibit MEK1 and MEK2, which are signal transduction proteins in the RAS, RAF, MEK, ERK pathway that leads from tyrosine kinase receptors at the surface of tumor cells and then activates cell proliferation and promotes survival. After inhibition of MEK, there's reduced phosphorylation of ERK, leading to reduced promotion of cell proliferation and cell survival. And so this pathway is known to be activated in NF1 plexiform neurofibroma tumors, since the loss of neurofibroma leads to overactive RAS GTP activity and excessive activation of the RAF MEK ERK pathway, again leading to excessive cell proliferation and plexiform tumor formation. And there's actually been a study by Dombey et al., also published in New England Journal in 2016, looking at a mouse NF1 plexiform tumor model. And in that model, selumetinib was able to inhibit ERK phosphorylation and reduce plexiform tumor formation, volume, and proliferation. In the SPRINT study, inoperable tumors were defined as a plexiform neurofibroma that could not be fully resected without high risk for substantial morbidity due to encasement of or close proximity to vital structures, tumor invasiveness, or tumors with high vascularity. In the study, the primary endpoints were overall response rate using 3-dimensional MRI and the Raines response criteria. And this included a percentage of complete responses or confirmed partial responses that were greater than or equal to 20% reduction in target tumor volume, confirmed at a subsequent MRI in 3 to 6 months. There were also secondary endpoints in the SPRINT trial, including duration of response and safety profile. There was also an exploratory endpoint that was included on pain intensity ratings of the affected children. In terms of efficacy of the drug in this trial, 66% of the cohort, roughly 33 patients, achieved a confirmed partial response. There weren't any actual complete responses, but those PRs were seen in, again, 2/3 of people. 82% of those patients with PRs remained in response after 12 months of follow-up. And the median best percentage change in target tumor volume from baseline was minus 27.85%, which is, again, a significant tumor reduction in what's supposed to be a slow-growing benign tumor. And the median time to onset of response was 7.2 months. In terms of the duration of response, by 12 months or more, 82% of the patients were still responding with their PR. And at 16 months, 67% of the patients were still responding with their partial response. In terms of the exploratory endpoint of pain intensity rating, there were 24 patients that were able to give pain intensity rating responses, and 50% of those noted an improvement of pain of 2 points or more by prior to cycle 13. In terms of common adverse reactions in the study, in terms of the most common things seen across all grades, the most common things noted were vomiting, abdominal pain, diarrhea, nausea, stomatitis, rash, and paronychia. In terms of reactions at grade 3 or grade 4, they were limited to vomiting, diarrhea, rash, and pyrexia. In terms of the clinical significance of the SPRINT trial, I think it's important to note that in a natural history study of NF1 plexiform neurofibromas, they were noted to have a strong tendency to grow over time and are often very symptomatic, and they almost never spontaneously resolve or improve on their own. And so it's now important that we have an FDA-approved chemotherapy option for these inoperable tumors with a proven benefit in terms of tumor shrinkage and possibly improving patient symptoms. I feel that selumetinib should be considered for any NF1 patient with a plexiform tumor that is symptomatic and inoperable, especially tumors that are large, cause significant pain, weakness, or disfigurement. And the question always comes up, should the treatment be started early or later on? And I think in general, an earlier approach is better since the drug can often cause tumor shrinkage and improve symptoms. And this is more likely in a smaller tumor, which has less permanent damage to surrounding nerves, structures in the region, and soft tissues. And then there's a question about, is selumetinib better than just using symptomatic treatment? And again, I think it is much better than that because, again, you have a greater than 50% chance of shrinking the tumor and improving tumor-related symptoms such as pain, disfigurement, weakness, and gait difficulty, whereas symptomatic treatment will really not help those symptoms very much.